So we have seen till now what is dyspnea, what is the definition of dyspnea, what are the various causes of dyspnea. What are the various causes of dyspnea? Respiratory, that is pulmonary causes, cardiac causes, mixed and non-cardiac, non-pulmonary. And also we have seen types of dyspnea, orthopnea and paroxysmal dyspnea. And also we have seen pathophysiology, how it is going to affect, how the patient develops dyspnea we have seen, and what are the diagnostic measures or evaluation can be done for a patient with dyspnea. Then come to the medical management, we have seen detailed medical management of pharmacological management, oxygenation, physical techniques, psychosocial techniques, airway management. And in airway management we have seen mobilization of pulmonary secretion, how to mobilize the pulmonary secretions like hydration, humidification, nebulization, coughing techniques, chest physiotherapy, suctioning techniques and maintenance of lung expansion. So come to the nursing management. As nurses, what we are supposed to do for the patient with the dyspnea? As you see, first the patient with the dyspnea, assess the respiratory status, and there is it's a situation where patient developed a dyspnea. Monitor the patient. First assess respiratory status, then the next one, monitor the status, monitor the condition also, assess the respiratory status as well as monitor the condition continuously, and change the position. We have seen semipolar change of position. So offer semi-Fowler's position. Of a semi-Fowler's position, that is 45 degrees angle, in order to improve the chest expansion, right? And also in order to humidify, we can provide air conditioners or cool air to the patient, so that oxygen with relative humidity keeps the airway moist as well as it loosens the pulmonary secretions. In order to make this, use fan or air conditioner or air cooler, so that make the patient breathe and oxygen with the relative humidity, so that it keeps the airway moist and loosens the pulmonary secretion. And humidified air, that is, even when we give oxygenation, humidified oxygenation can be done. So with the help of amount of water we can administer, and as ordered according to the doctor's order, amount of liters of oxygen can be administered. And also pharmacological administer the drugs which are prescribed, like bronchodilators or steroids, or else mucolytics, any syrups, cough syrups, all that administer medical management, administer the drugs according to the doctor's order. And also antibiotics, if there is any signs of infection here, as nurses we have to administer the antibiotics also, in order to relieve the congestion as well as relieve the cough, as well as to decrease the apprehension. As the patient is having decreased that is increased labored breathing, or patient is suffering with unable to breathe, labored breathing or shortness of breath, surely patient will be getting into apprehension. In order to elevate the apprehension that is developed because of dyspnea, administer the drugs which are prescribed. At the same time, administer cough syrups also to decrease the apprehension. And also do the chest physiotherapy, as it can easily, it's a method to easily remove the chest pulmonary secretions. offer nebulization, perform nebulization, that also comes under medical management in order to clear the pulmonary secretions, offer the patient with nebulization. Come to the suctioning, if patient is on bed like ventilated patient, or if patient is unconscious, if secretions are there, because of that respiratory pulmonary secretions obstructing the breathing pattern, then go for oropharyngeal secretions, nasopharyngeal secretions, orotracheal secretion, nasotracheal secretion, or tracheal secretion. According to the preferred method advised by the physicians, we can go for suctioning also. In order to maintain the lung expansion, as nurses we can position the patient, as we have already discussed in change of position, and also offer the patient and encourage the patient to manage with incentive spirometry. It gives a visual feedback of flow and volume orientation. How much amount of fluid is being taken, how much volume of air is being expelled is even addressed by the patient. So as they continuously use this incentive spirometry, they can continuously expand. You can give it's like a feedback for them, so that they can strengthen the lung capacity, and encourage the patient deep breathing exercises. Explain the patient about deep breathing exercises, especially breathing techniques you can demonstrate, like pursed lip breathing and diaphragmatic breathing. With this we have finished about dyspnea. What is dyspnea? It's a subjective sign expressed by the patient, which is very difficult to manage, right? And what is definition of dyspnea? It's a subjective feeling, difficult or labored breathing or shortness of breath. It's because of cardiac or pulmonary reasons. And what are the various causes? We have seen 4 reasons: cardiac, pulmonary, both mixed, and non-cardiac, non-pulmonary. And types of dyspnea like orthopnea, paroxysmal, nocturnal dyspnea. And pathophysiology, because of any of the reason, there is a chance of infection and inflammation of the lung parenchymal cells, which decreases the lung compliance and increases the airway resistance and develops a dyspnea. And diagnostic procedures like history taking, physical examination, and pulse oximetry, and also ECG and chest X-ray, CT scan, pulmonary function test, arterial blood graph analysis, and treadmill test in case cardiac diseases. Come to the medical management, we have seen pharmacological, oxygen therapy, physical test, reconditioning, physical techniques, psychosocial techniques, airway management, and mobilization of pulmonary secretions using hydration and humidification, nebulization, coughing techniques, chest physiotherapy, suctioning techniques, and maintenance of lung expansion by positioning the patient. Come to the nursing management. So as a nurse, when we try to manage a patient with a dyspnea, assess their respiratory status. What is the respiratory rate? We have to see what is that the labored breathing, the reason for their dyspnea. We have to try to analyze and monitor the status of the patient as the patient is getting into dyspnea. Do not leave the patient as like that. Once you manage the case, continue to monitor the patient. Change of position is very important whenever you see the patient with a dyspnea, like semi-follis position is important. And humidified air, offer humidified air, and administer all the medical drugs like specified drugs in case infection, antibiotics, and to relieve the dyspnea, bronchodilators, steroids, and mucolytic, especially when there are secretions, mucolytics can be administered. And patients having an apprehension, give the anti-anxiolytics. With this we have finished dyspnea.